In 2025, Medicare is going to completely change how they do Part D prescription drugs. I've been helping seniors navigate the medical field for the last 10 years, specifically Medicare and Medicare Part D. And in this video, I'm going to talk to you about what needs to be done, what's kind of changing, and how you can best prepare. So first, I'm just going to go right into it. My name is Matt Ragudo. I've been doing this again for over a decade. I help folks who are navigating into Medicare. Also, I help employer groups figure out how to transition their folks from their group plan onto the Medicare program so that there's seamless transition. Now, Medicare is great, but this change is going to change a lot of things for those of you on Medicare and those of you who are going into Medicare. Now, let me explain. The Inflation Reduction Act, which was signed into law in 2022, is unraveling, or is actually going into effect in 2025 for this new provision, and that's the cap, meaning all prescription drugs, they're going to cap the annual calendar year spend to $2,000. Now, every year that's going to go up. So if you're watching this and it's 2026, it might be higher. But for 2025, it's $2,000 for Part D spending, whether you're on a Medicare Advantage plan, so it's a Part C plan, or a Part D plan. Now, if you are my client and if you're following along with what I do, I always make sure that we find the drug plan that's going to save you the most money, and also make sure that the Part C plan you're enrolled in covers not only the doctors and hospitals, but the medications. Now, in 2025, it's going to be even harder because what's happening and what we're seeing now in the industry is certain players are leaving. Mutual of Omaha, who's been in the Part D space for a while now, has announced that they are pulling out. They are no longer going to be offering Part D plans for 2025. The reason for this is by putting a cap on the amount of money Medicare beneficiaries can pay for medications, that money has to come from somewhere. And the Medicare Part D plans, or Part C plans with the drug plan attached to it, they're the ones that are going to be having to subsidize and pay for this. So what they're going to do, and what they probably will do, I'm not sure as I haven't seen anything yet, they are going to start either increasing the premiums and cut down on the amount of medications they cover. So recently, this year, there's a Part D plan that's 50 cents a month. In some counties, it's no additional cost. That plan will most likely disappear or will be much more expensive next year. So if you are in that plan, your default, they call mapping, where they will automatically assign you a like plan, could be much higher per month and still offer relatively low drug variance and higher copays. So what I would do is make sure whoever your agent is knows your medications. So for all of my clients out there who are watching, please email me all the medications that you're taking. That way I can have them preloaded into my system. And when when it's time to do an analysis for AEP in 2025, we're able to get and plug it all in so it's just seamless. And we can figure out what plan is going to save you the most money and what Part C plan, if you're on Part C, is going to be the best for you. Now, for those of you who are on the Part C plan, there's more. So for you Part D users only, you don't have to watch any further. I'm going to go into what I see coming for Medicare Advantage. So Medicare Advantage shares in the kind of premium for both Medicare Part C, which is the medical portion, A and B stuff, and Part D, which is the pharmacy I call it pharmacy insurance, where when you go to the pharmacy, you pick up meds. So Part C plan shares those costs all in one. It's bundled all in. So if one part gets incredibly more expensive, it will start taking away from the other side, or they'll increase premiums. So some carriers will be more than likely next year are going to start shaving off their benefits. So maybe dental's going to go away, maybe vision's going to go away, right? Everything that Medicare A and B do not cover, like gym memberships, transportation, over-the-counter cards, grocery cards, dental, vision, hearing, all of those things could start either getting really, really limited or completely vanish. So you're going to have to really assess your plans. And for all of my clients out there, you know that when I send out my annual letter, I ask you which ones are more important so that we can kind of figure out, which ones, which plans anyway, I should be looking at when I do my analysis on all the plans and figure out which ones has the richest benefits and the networks that would match your doctors. And having all that information ahead of time will make the transition as far as what AEP is going to look like with this new law coming into effect much easier and seamless, so that we're not having to spend too much time gathering all the information when we can have it all right now. Now, with that said, I really do hope that for those of you who are not my clients and are just listening in, you will contact your agent and find out what they're doing to kind of buff or preface this, because it is very, very important for all of us, agents and Medicare beneficiaries, to be ready, and just so that we can not get blown up when it happens, right? Because what I will tell you is that the way that Part D works, Part C plans with Part D, if it's not covered, it's 100% out of your pocket, and they're going to start removing medications from the formulary. I can almost guarantee that they will, or boost up that premium. So if you have any questions about this, any questions about how this law or anything Medicare related is coming into effect and affecting you, please let me know in the comments below, and I hope to hear from you. If you're my client, if you're not my client, please just leave me questions. If you can't get in touch with your agent, I'll be more than happy to figure out if I can help you in the following year for AEP. Have a good day, do good things, and I'll see you later.